From the point that I started feeling depressed and saw my doctor and then had the incident until I had seen a psychiatrist and had started on medication and had a plan and felt like I was in control of what kind of moods and emotions I had was a year and a half. I still had a couple of other times where I felt like I still was getting close to having not only a plan but an intention to act on a plan to hurt myself. I ended up calling a friend who called 911. I didn't know who was going to show up. The police car shows up. Not an ideal thing where I'm like, oh, I guess this is my ride to the hospital. When I showed up, it was already full. Like, if there were already that many people having crises that were there for that night. I'm walking into an emergency room where I'm in very visible pain and have very visible physical injuries, and you just feel so out of place in an emergency room that you would not think that this is the spot that I should stop or go to. They, at the time, had all the rooms filled up for the overnight. You feel like, well, I'm mostly on my own here. I'm in a safe place, but I'm here alone. Like, if you show up to a hospital or an emergency room, yeah, your arm's broken. There's a whole series of steps that are clear to everybody. They feel so not right that you want to stop living, and also you don't know what path you're supposed to go on to feel better.
Victoria Hospital is a community hospital, and with clinical consolidation in 2017, our emergency department was going to be converted into an urgent care. But we were also going to be a high acute mental health facility, increasing our bed base from 21 to 75. And so in order to be able to manage the incoming through our urgent care, we needed to make sure that we were creating a safe environment not only for our patients, but also for our staff. Our guiding principles and our vision were always that it had to be a calm, home-like environment. Only time will tell. It is brand new here in Manitoba. We don't have one like it, but there is no doubt in my mind that this is the right environment for these patients at this time in their illness. The Manitoba Blue Cross Mental Health Assessment Unit is something that we should all be proud of as Manitobans. The donor support has been exceptional, and their support is allowing us to deliver the best possible care. Our community partners will continue to support these types of innovative initiatives because it's only together that we can really heal the community. Tranquility Trail is an outdoor space, and we will have specialized programming such as arts and crafts, gardening, yoga, exercise, and even just being able to have space for independence and recovery, and a space where they will be safe and still feel like they're part of the outdoors for however long they feel necessary for their recovery.
If I want to seriously hurt myself because I have a mental illness, it shouldn't be 40 minutes or more before I have something that's either close to me or that's built for the thing that's happening to me to come to. So building and supporting stuff like this is supporting the urgency of the kind of care that people that you know need.